Hello, and thank you for joining us for this episode of Community Forum. My name is Monet Chartier, and I am today's guest host. With me today is Kimberly Morgan, the CEO of the United Way of Western Connecticut, and we're here to talk today about the United Way's groundbreaking report called ALICE, which stands for Asset Limited, Income Constrained, Employed. Before we get started, hi Kim, welcome.
Thank you very much.
I welcome you here to Community Forum, and thanks for talking to us about this fascinating ALICE topic here in Connecticut. Before we get started, can you tell me a little bit about yourself and how you got interested to working in the nonprofit sector?
Sure. I've been raised and grew up and worked in this community my entire life, and worked in the nonprofit field for over 20 years. Started with a background in mental health and residential, working with families who really struggled to be able to live independently and deal with things like substance abuse and mental illness and housing issues. And I've been with United Way now for 10 years.
Terrific. It's wonderful. Let's see. So I mentioned ALICE in my introduction. Can you tell us who ALICE is and how United Way has helped identify this certain population?
We're really excited about this report. So I want to say again, ALICE stands for Asset Limited, Income Constrained, and Employed. Mm-hmm. We're talking about families who live paycheck to paycheck, week to week, month to month. These families are families who work really hard, 2 to 3 jobs often, trying to raise their family, and yet can't make it every month without huge worries or being one step away from falling off a financial cliff. The United Ways in Connecticut and in 5 other states across the country this year released this ALICE report. We pooled our resources. We wanted something that would be statewide, countywide, and then also town by town. And so the United Ways in Connecticut worked with Rutgers University, and the report was released this past November. In the report, it was really interesting. We found that these families we call ALICE, they're about 35% of the population in Connecticut, fall at the ALICE threshold or below, which is very, very significant. When you look at Danbury in particular, Danbury is 35%, 36%. But all of our surrounding communities are also up there, 15, 19, 25%. You'll find ALICE families in every single community that we live in Connecticut.
So these are families who are employed, they're playing by the rules, and they're just not being able to make ends meet?
Yeah, they make too much for government support for the most part. They are working hard, so they can't necessarily navigate all the social service systems that might be there to be serve as a safety net. Mm-hmm. And they're playing by the rules. They're doing the best that they can, raising their families and trying to live in their communities. And they don't often have a name or an identity. We're used to talking a lot of times about the poor, whose incomes, if you're considered poor, is very extreme. ALICE families are the ones that are right smack in the middle, that shrinking middle class, where they would have been able to live on the income that they're making 15, 20 years ago. It's not enough today. So they make too much for the government assistance and not enough to get through the month.
Okay, I see.
One of the things that was highlighted in the report that we found interesting there are really 4 new measures of economic hardship that we're defining through the ALICE report. Those are survival budget. What does it look like? We're looking at the ALICE threshold, which is how much do you need to make as a family to get over that threshold so that you don't have to worry every single month. Okay. We're looking at income assessment. Really, how much do you need to fill that gap to get over the threshold? What kind of savings do you need in place? And then the report really looked at also economic viability indicators. So it looked at housing, job opportunities, and community support, and how in each community those 3 are intertwined and what kind of rating that gives the community.
So there's 4 major components of what constitutes an ALICE family.
Yes, yep.
Can you tell me more about the survival budget?
Sure. In Connecticut, a household survival budget for a single adult is about $22,000. For a family of 4 with an infant and a child in preschool, it is over $64,000.
Survival, just to pay their bills.
Just to get through the month. Wow. That's not with a lot of fluff or extra funds to do a lot. It's very expensive, especially in Fairfield County. Connecticut, out of the 6 states, was the highest cost of living. So while we had 35% of our population, some of the states have higher ALICE populations, the cost of living is nowhere near what it is for us in Connecticut.
Okay. Can you tell me more about what an ALICE family might look like?
So the interesting thing that we find people are really responding to is that ALICE, we all know ALICE. It's our child care worker, it's our health care worker. You know, if we have an aging parent in the home and we need somebody to come in, or they're going into a nursing home and there's somebody caring for them, most likely that's somebody who's from an ALICE family. The service industries, our nonprofits, the safety net that's there to support families in need is run by families often in need, because we don't pay our nonprofit staff a comparable wage to the for-profit industry. So everywhere we turn and everywhere we look, we rely on ALICE to fill the jobs that make our community what it is, and to make our lives what they are. You know, you go to the dry cleaners, you go to the grocery store. ALICE is everybody everywhere. And they found that across the country when they studied this, that the ALICE population is very congruent with the demographics of the general population.
Okay.
So it's not one minority group or another, it's really across the board, the population that's in your community is represented.
So it's a large amount, 36% in Danbury and the surrounding communities. How do we go about finding these or targeting these populations? How do we know where to find them?
Yeah, one of the things I think United Way is going to be working on in the coming year is really saying, who are they, right? What are the stories? We want to take ALICE out of the shadows. These families are very proud and they're working really hard. So how do we get their stories, and how do we tell a compelling story to our donors? Because we need to support them. Their job opportunities are not going to change overnight. Our goal is to move people above the ALICE threshold, so beyond living on that survival household budget. How do we do that? What kind of supports do they need? We really need to talk directly to our friends and neighbors, and not always rely on the government or social services to tell us what people need. We need to hear it directly from ALICE.
So we're listening to a lot of ALICE families. And what are they saying, Kim? What are some of the compelling stories that we're hearing in our area?
You know, we know that in an ALICE budget, the housing and the child care are the most expensive budget items. So they can take over 50% of your budget easily. Housing can take 50% often. And childcare, quality childcare, is one of those things that many people can't afford, and they find someone to watch their child. We pay as a society down the road because that child shows up in the public school system not ready for kindergarten, and unfortunately often never catches up. The statistics are staggering. If you don't work with children early, between birth and 5, before they get into the school system, they don't catch up. Their vocabulary level, the studies that have been done on showing families in poverty compared to families with assets and access to wealth are astounding. And yet we don't do anything until they get to school. So the cost of childcare is really important to United Way. We funded over $500,000 this year in just early childhood alone, trying to help families get their children ready for kindergarten. The economic security for that family long term is so much better when that child starts school equal to their peers.
Ready to learn.
Yeah.
And how does the parents get this quality education when they're busy working 2 or 3 jobs each? How do they coordinate that?
Well, we have early childhood councils in all of our communities and coalitions, and we direct families to the programs that are available, but there are waiting lists. The interesting piece that United Way can play that is a need in the community is funding preschool slots, supporting schools that also get some support from the government. But these are families that aren't eligible for, say, Head Start because they're just above that income threshold. So they need to go to a school that would be a private pay. How do we support that? And United Way supports that through funding a lot of the preschools and the programs. And also working in the community, supporting play groups for families, for parents to, we do our Imagination Library program, which is a free book to every child under 5 in the mail every month to encourage reading and give access to books. There's a lot of different programs that we put in place to support that family when their children are young. But then you look at housing. Housing is very expensive in our area. And that's where you see a lot of the gap, right? You've got our wealthy suburbs where the houses are, $500,000 to $1 million, and then we've got really poor neighborhoods right in our communities where 5 families are doubling up together. You can drive through Danbury and count the number of satellite dishes on each building to see how many families are in that building. And it's a necessity, right? They don't have the funds to afford housing in this area. So what can we do? We support programs like security deposit programs. So if you have a job and you can pay the rent, a barrier is often security deposits.
Sure.
Moving is an expense. And so often families get stuck or end up homeless, quite honestly, if they're not able to have access to those funds. We support programs like a car loan program. Transportation is critical for families. A lot of times these families work nights. They don't work on the bus route. They're going into homes in the suburbs and businesses in the suburbs, so they need reliable transportation. We find that a transportation crisis or a health crisis are often the thing that then spirals them into financial hardship and tips them over. And so we support programs that give out car loans that people pay back through Catholic Charities. There are a lot of programs that are knit together in our communities, and United Way is really about finding, creating a system so that people don't fall through those cracks.
Right. So it sounds like it's not just one program, it's sort of a safety net in a few different areas, something they wouldn't rely on completely, but just during that transitional time, during that crisis, and then they get back on their feet again.
Yeah. When we think about things like food, for example, and health, for Alice families, that's a big thing. It's much easier to go to McDonald's or buy pasta than it is to feed your children a healthy meal. And so one of our issues that we work on is childhood obesity in healthy children. Well, that's very difficult to do when you have a family that has a limited income. So we work with after school and preschool programs on getting healthy foods in there, working with farmers markets, educating parents on how to feed their children in a healthy way on a budget, and incorporating that message into all the different access points that we have people coming in. One of the things that we did in the past year and a half was form a Danbury Food Collaborative. When you think about a family working 2 or 3 jobs, this is not a family that necessarily goes to a soup kitchen. They go to a food pantry though, maybe once a month, and stock up on things. Trying to figure out how to navigate that system is very complex. You would have to know to go to Salvation Army on one day from 2 to 5, and St. James on another day from 3 to 6. One's once a month, one's once a week, what kind of food, who they serve. So we pulled together the pantries and they formed a collaborative. And in a year, we've been able to get them all refrigerator units so that they can serve fresh, healthy food. We found out from a survey they did together that was really important. And we said, that's great, because that fits our mission as well with healthy families. We created a navigation guide, so families don't have to figure all this out. It's all in a booklet. They can go on our website, they can get the information, and then they can plan out how they're gonna access the food. And then we go out and we do food drives together. There's not enough money and not enough resources for all of our nonprofits not to be working together for these families and make it as simple as possible. One of the other things we've done is we have a financial resource center. That's a virtual center where we use volunteer budget coaches to work with Alice families. We had one father, amazing story. He was one of our first people that came to the center, worked with a volunteer, so it's very cost efficient. And he was a struggling single father of 2. He had 2 boys. And he had $10 left at the end of the month. It made him very nervous. He said he's one catastrophic event away from not being able to take care of his children. So we put him with the coach, and they spent a few months, and he learned a lot. He learned how to manage a budget. He learned about his taxes. He learned where he could save dollars. And within 6 to 9 months, they actually figured that it would be more cost effective if he bought a home as opposed to where he was renting. And so today, just because of the help of a volunteer, he's living in a home, he's much more self-sufficient, he's not up every night worrying about his boys or how he's going to take care of them. And what did that cost? It cost United Way coordinating a little bit and connecting him to a volunteer and using someone's skills. He's not somebody that's going to need help in the future the way he needed at that point. But had he not gotten that support and that education, something could have happened, and he could be another statistic and be using a lot of expensive services to get by. And once you fall into that pit, that financial cliff, it is really hard to get out. So we want to prevent that from happening for every family that we can.
So it sounds like you're really coordinating the efforts to support the families where they need help to get them through. So we've talked about several challenges: housing, transportation, child care, understanding basic budgets, and how a financial strategy for their family. What other kind of challenges are facing our families in this ALICE population?